And welcome to KTOO News' live 1-hour special on Bartlett Regional Hospital. Juneau's city-owned hospital has seen a lot of upper-level staff turnover in the last year, and today marks year 2 of the COVID-19 pandemic. As the board works on recruiting new leaders, what does the future of Juneau's city-owned hospital look like? I'm Rasha McChesney, Daily News Editor for KTOO. This forum is airing live on KTOO 104.3 as well as at ktoo.org. For those of you watching online, you'll see that due to the ongoing COVID-19 pandemic, we are not all live in the studio. Several of our guests and myself are joining remotely via Zoom. In the studio is my co-host, KTOO reporter Claire Strimple.
Good morning. We've got a lot to cover in the next hour. We've asked you, our audience, to send us your questions, and we've got some questions of our own. We're here to talk about hospital management, operations, and the ongoing COVID-19 pandemic. I'll introduce today's guests. Interim CEO Gerald Humphrey is here. He joined Bartlett in October of last year. He was hired on contract and is slated to stay on with the hospital until the board finds a permanent replacement. Good morning.
Good morning.
Chief Clinical Officer Kim McDowell is also joining us. She started working at Bartlett in the emergency department in 2015 and assumed her new role this year. Good morning, Kim.
Good morning.
Interim Chief Behavioral Health Officer Karen Forrest is here. She took on her role in October of last year. She's a former Deputy Commissioner for the state's Department of Health and Social Services and more recently had a leadership role with JAMI Health and Wellness in Juneau. Good morning, Karen.
Good morning.
And Kenny Solomon Gross heads the hospital's board of directors. Good morning, Kenny.
Good morning.
And Juneau Assembly member Michelle Hale is the Assembly's liaison to the hospital board. Good morning, Michelle.
Good morning. Thanks for being here.
And the hospital added a couple guests late yesterday afternoon. Interim Chief Financial Officer Bob Tyke, HR Director Dallas Hargrave, and Bartlett Quality Director Gail Moorhead. We'll try to squeeze in a few questions with you guys as well. Thank you for tuning in, and I'll turn it over to Rasha to get us started.
Thank you, Claire. So Bartlett Regional Hospital has seen a lot of upper-level staff turnover in the last year, and at last count, that was 2 chief executive officers, a chief financial officer, a chief operating officer, and a chief behavioral health officer. We have interim CEO Gerald Humphrey and Chief Clinical Officer Kim McDowell here to talk about steering the hospital through these changes. Kim, you've worked your way up into your role in hospital management. What impact has that top-level turnover had on staff?
Thank you for that. I think, being here since 2015 and kind of working my way up through management and seeing the turnover, I think it's fair to say that it's impacted staff a lot. I mean, it's, the team's very strong and resilient, but, a lot of the higher senior leaderships that we saw with the turnover recently had been here for many years and had history within our organization and other positions. And so it was, as with any turnover in any organization, it does affect the staff somewhat. I think we're kind of turning the teams around and they're very strong and they're really happy in the direction we're heading currently.
And how have you sort of personally navigated those changes in your longtime workplace?
For me personally, it's always just, I learned early in my nursing career to always put the patient in the center of everything I do. And I have carried that with me all through my nursing career. And so my priority is putting the patient center and make sure we do great patient-centered care. And then my next priority is making sure we support and take care of the staff.
Thank you. And Gerald, you are a career interim CEO for hospitals. That's a very specific job. What is the role of an interim CEO?
Well, thank you, Rasha. First, I'd just like to say I appreciate you adding a few people to the panel. From an administrative standpoint, we feel that this is really a great opportunity for us to let the CBJ community know what great things are happening at Bartlett. Yes, we have some turmoil here and there, and we want to answer any questions and concerns that are out there, but at the same time, we've got a lot of great things that are happening in behavioral health and in nursing, the ED. We've got just great stuff, and Kenny, I know will want to talk about this as well, but in terms of my role as interim, I guess I am a career interim as CEO, but I had an extensive career and a much more stable atmosphere with Memorial Hermann in Houston, Texas. I was CEO of 3 of their hospitals and had a career there for 25 years. So I only got into interim after I kind of took an early retirement and found out you can only play so much golf, and really missed operations. That's my passion. I started working in hospitals in dietary and became a hospital orderly and worked my way through, and then went and got my master's in Washington, D.C. at George Washington University. And I've really just kind of a hospital rat, so to speak. So I love hospital operations, and the interim role is something I've found to be really beneficial to myself as well as to organizations that I can apply the background and experience that I've gained over 35 years of hospital management experience. And so I'm really happy to be here at Bartlett. And, I find this group to be an amazing collection of managers and employees in a really unique area. I've never been to Alaska before. I've never been to Juneau. I can't say that I've really enjoyed this winter, but I understand this is a little bit of an exception, but at least we're not 30 or 40 below. And I'm happy about that. And I'm happy that it's snowing outside, but it doesn't seem to be sticking. So life is good for me. And I don't know if I've answered your question or not, but that's my background.
Great. Memorial Hermann's actually my home hospital, so it's interesting to hear that you were.
Oh, I had no idea, Rasha. Yeah.
So you, as an interim, have sat at the table of many hospitals. Is what you see, I mean, you mentioned there's this sort of turmoil at Bartlett. Is what you see happening at Bartlett unique, or have you managed such a sort of rapidly shifting management before?
No, unfortunately, it's pretty much the norm, Rasha. And as an interim, and Bob can talk to this as well in CFO interim roles, we get called in because there is turmoil. I mean, you have a CEO that leaves, or you have a need, and you need some leadership that you didn't have on staff or is not available. So we're kind of used to coming into these things. And I'd say Bartlett is managing the roller coaster effects of leadership changes and what have you very well. And as I've told Dallas, and I've worked with Kenny and very closely with the organizational changes, I'm always looking for better organizational structure if I can find it. It's really imperative in today's healthcare climate that we are as lean and efficient as we can possibly be, and where you have opportunities to consolidate and gain efficiencies, it's just imperative. And that's basically what I've done at Bartlett with the reorganization that moved Kim into our chief clinical officer role. We consolidated some administrative positions, and it's really making for a much more efficient organization. Unfortunately, that comes at a time when we still have had some turnover at the CEO level and the CFO level who chose to retire. So these timings get kind of meshed together with unfortunate issues that have come up because of people's poor choices or what have you. And then other people have career issues that they're making decisions on at the same time. And these collide and you have to deal with them. And so that may look like to the outside community that there's a lot of turmoil, but it really is not that bad from a leadership standpoint. And again, I point to, we have a very strong and stable management director level staff at Bartlett. They do an outstanding job. We just had a joint commission survey where we got commended by the surveyors, I don't know how many times, for great processes and great policies and procedures. So I'll leave it at that, but that's kind of where we're at right now.
Darryl, thank you. Kim, has the pandemic changed the way that you approach your role?
That's a great question, and I don't know if I have a great answer. Of course, it has changed the way I approach my role. I think that for me personally, moving into this role and kind of being new to leadership, I've really relied on the boots on the ground staff to really lead me and what they need and how to help them be successful in managing the pandemic. We see this all across the nation and the world, frankly, just the impact that the pandemic had on nursing and nursing homes and people just across the country and the world, and trying to support them in that pandemic. As we know that things changed, at one point when the first round of COVID came, things were changing literally minute by minute with what needed to happen as far as PPE and how we were going to handle patients. So I think it really allowed me, I say this a lot, there's a lot of negativity that came through COVID, and it's easy to focus on the negative, but there's a lot of positive that came through, and it's really a gift, because what it allowed me to do was really to turn the reins over, so to speak, to the staff and say, what makes sense to you going through this pandemic? You're the ones that are doing the daily ins and outs of caring for these patients, and what processes and what things do we need to change to make this easier on you and to be supportive of our patients. So I would say that was one thing that the pandemic did change as far as my leadership style, is to just really, be vulnerable in this space and allow the teams to direct me in what they need, and provide that support for them.
Great. And I have a question from a listener that I think might be yours to answer, but feel free to punch it if it isn't. This listener asks or mentions that rural medicine has some really unique challenges, especially in Southeast Alaska. And what measures has the hospital taken to ensure that patients in those rural communities that Bartlett serves are receiving up-to-date care versus, well, this is the way we've always done it mentality?
I'll start, and then anybody on the panel can jump in. From my standpoint, especially from my history being working in the emergency department, we work really closely with the clinics. They're just a phone call away. If there's somebody that's having a challenge, we work closely with our medevac teams to be able to get people to definitive care if they can't get that in the clinic, that in the community health area that they're at. And some of our education departments, or instructors, go out and help teach in other communities, like our trauma nurse courses, pediatric emergency courses, and help prepare them also for in the moment emergencies until the patient can get to definitive care. So I hope that answered your question. And Gail, if you have more to add, feel free to jump in.
Sure, I agree with what Kim has said. I think that as Bartlett, we need to partner with other areas. We have very strong contacts with Seattle and Anchorage, and we pull in our resources. So Juneau doesn't live in a silo. We are always looking for bringing in the best education and the best care we can, and utilizing our Northwest connections. And I think that's where we've built some strong partnerships.
Great. Thank you, Gail. If you're just tuning in, I'm Rasha McChesney with Claire Strimple, and this is a special program from KTOO News on Bartlett Regional Hospital. We also have some top-level leadership here from the hospital, as well as Kenny Solomon-Gross and Michelle Hale from the Hospital Board and Juneau Assembly. The board oversees the hospital, and the city assembly picks the board members. So the ultimate responsibility for making sure the hospital is running the way it's supposed to falls to them. This question, we had a lot of listener questions about the hospital's relationship with SEARCH, the Southeast Alaska Regional Health Consortium, and many of them wanted to know if SEARCH approached Bartlett Hospital about taking over or purchasing the hospital. Is that a question for y'all?
I guess I could start with this. First of all, the main concern of Bartlett Hospital and all of our nurses and staff and doctors is to make sure that our community is served. So anytime that there's anything going on, and Kim went and said that it's really concentrating on patient-centered care. So with that being said, I've been approached by a bunch of people in the community just recently saying, "Oh, I heard SEARCH is gonna buy Bartlett." I can honestly tell you, I have never heard from a SEARCH person asking me or anybody, wanting to buy Bartlett Hospital. In this space, there is room for all of us. SEARCH needs Bartlett. SEARCH takes care of their people, and now they're expanding their services, but they need a hospital. They need to be able to have their physicians care for their patients in our hospital. So, Bartlett works with SEARCH. And one thing that at our board retreat, our board of directors has asked Mr. Humphreys to reach out to Search, because we have a lease with them right now down at the bottom of the hill where our surgeons are at, and our lease is up at the end of the year, and we are hoping to get a hold of them and possibly see if we can extend that. And I know that Mr. Humphreys is going to be meeting with the head of Search very shortly. So it'll give a good opportunity for Bartlett leadership in the operations to be able to start a conversation with Search as far as where they're going and where Bartlett is going to. But the flat out answer to you is we have not heard, I have not heard, and I can't speak for Ms. Hale, but have not heard from anybody representing Search wanting or asking to buy Bartlett Hospital.
Kenny, thank you so much. It's something we've been hearing a lot in recent months as well. I wonder where that came from. And I have another one for you from a listener, and this listener worries that there's a culture of fear in the hospital that's resulted from a lot of the leadership leaving. So what active measures is the board considering to battle that culture that has resulted in multiple employees finding employment elsewhere?
So, before any of us that I can see on this panel were here, there was another regime that I believe that even before Mr. Bill came here as our CEO, where there was this culture of fear. I can't speak of something that's happened in the past, but I really would want maybe someone like Dallas or Kim to talk about how the staff feels, whether or not there is a culture of fear. But I know that our interim CEO, Gerald, who you've just heard from, he is not about fear. He is not a leader with fear. And he doesn't want his managers or his directors to lead with fear. So I also know that our chiefs, that we have, Kim is not a leader that would lead by any type of fear. She's a person that's worked her way up, from a nurse to chief clinical officer. And Karen, who not only, I know she's just an interim here, but she has had some really big jobs, deputy commissioner, for the state of Alaska. Believe me, you don't get there by treating people with fear. So I can tell you that this is not the way the direction of Bartlett is going. And this is not the way that I believe that anybody is leaving because they are of fear of losing their job or any type of intimidation. But I would really like to hear Dallas and Kim answer that question too, if that's okay with you.
Thanks, Kenny. Dallas?
Sure, and I think I'll try to get back to your initial question, Rasha, which is if there is a culture of fear, what are we doing to try to manage it? And I tend to agree with Kenny that I don't necessarily think there's a culture of fear. I do think there's kind of uncertainty with leadership changes that we've talked about earlier that everybody kind of works through when that happens. We're starting to be able to do some of the things that have been hard to do during the pandemic. Just this week, we started doing a supervisory training where we're training our supervisors again on how to work through, how to manage without fear, how to communicate well and give feedback. And so from the ground level up with supervisors, we're trying to kind of instill some of those skills and work on training folks through the organization to avoid situations like people feeling like they're coming from a culture of fear. And the reality of it is that Bartlett has some of the same staffing issues that are prevalent in the healthcare industry across the nation right now, with the Great Resignation that's occurring not only in healthcare but in other industries too. And it's in our interest to keep our staff. We have a great team. We want our team to stay here, and part of that is creating a work environment where people can kind of work through everything that's happened during the pandemic, and as we come out of the pandemic, situations where they're feeling good about coming to work. The other thing I'll say is I think really gets back to focusing on our mission, vision, and values, and making sure that throughout our organization, from leadership to managers to supervisors to staff, that we really kind of focus back on that. And that's that patient-centered approach that Kim talked about earlier.
Dallas, thank you. And I want to come back. This question is for Kenny. There have been some changes. Oh, I apologize. This question is for Michelle. Michelle, there have been some changes to city management of the hospital lately. The assembly voted to start paying the board, and the board started meeting with the whole assembly monthly. What's the goal with these changes? Is it working? What's changed?
Thanks, Rasha. I'll start with the assembly voting to pay the hospital. So Bartlett Hospital is a huge, very significant employer in Juneau. It's a large and very complex organization. And we are asking, the assembly is asking the board of directors to manage this organization. And the compensation that they are receiving now is really small. So it's almost, in a sense, a token of our appreciation, or recognition of the work that they do. But it is a recognition of the incredible workload that the board has. The board members attend committee meetings, they attend board meetings, they work, Mr. Solomon Gross works very closely with our CEO. We just have an incredibly busy and hardworking board. And so that compensation was just an effort to recognize the work that board puts in. The joint meetings, I'm sorry, I had to sort of reach back for what you said. So the joint meetings are really focused on facility planning. And the real purpose of those joint meetings is to make sure that both the assembly and the board are kind of on the same page in terms of long range facility planning that's going on at Bartlett as we look, one of the great things about being a liaison to the board is I've been able to attend one conference. And one of the things that I learned at a conference, and it's really a conference for board members and administrators of hospitals. And one of the things that I learned at that conference is that any hospital needs to be thinking 25 years out. We cannot be frozen where we are. We need to be thinking very long-term, mid-term, and short-term. And so that's the point of these monthly planning meetings, is just to get the people in the room and to be thinking in an ongoing way. And if I could add one thing to the idea of those joint planning meetings, I think I've been the liaison. This is my 4th year as the liaison to the Bartlett Hospital. And I have to say, it is an incredibly complex organization to even start to wrap a person's mind around. This is not, I don't come from a hospital background. I'm a chemist, but I don't come from a hospital background. And as liaison, there's an awful lot to learn. And so the other real advantage to having this monthly meeting is we have more assembly members that are becoming more familiar with hospital operations, which are complicated. The assembly work in general is complicated, and the hospital itself is very complicated.
Michelle, thank you. And Kenny, I have another question for you. You and I have talked about this in the past. Typically, the CEO is the person ultimately responsible for the hospital, and that person answers to the board. But Gerald is here temporarily, and we have a lot of other people here right now with interim in their title. So who is ultimately responsible for the things that go right at the hospital and the things that go wrong?
Rasha, that's a great question. So, as far as operational wise, Gerald is. He's our CEO. When we interviewed Gerald, he said to us that I come to any organization as if I'm here long term. So he has taken that job, as you've heard him speak, as if he's here for the long haul. And he's never said to me, "Oh, I'm not going to be here. I can't take on that role." He's always said, jumps right into the fire. So operational wise, Gerald is the person that is in charge, our CEO. And when we get our new CEO, that we're in the process of our search, I'm sure you'll be asking questions about that soon, they'll be the person that's in charge of operations. So yes, he is an interim, but he is the person ultimately that is responsible for operations of our hospital.
Kenny, thank you. If you're just tuning in, I'm Rasha McChesney with Claire Strimple, and this is a special program from KTOO News on Bartlett Regional Hospital. And Kenny, I'm gonna loop right back around to you. We got a lot of listener questions for the board. This one from a listener wants to know, as the board assesses leadership within Bartlett, do you feel it's a top-down approach or a bottom-up approach? And what actions are you taking to empower a nurse-driven environment?
Another very good question. Again, you know, the Bartlett board is a board that is in charge of policy. And when you ask a question like that, that goes to operations. So, you know, I would again turn that to our CEO, and as we navigate through the process of hiring a new CEO, or even with Gerald, I may ask his philosophy on how he feels that the structure of the organization could be. But you know, today I think that question would be more appropriate for someone in operations like a Gerald.
That's fine. You know, I'll be happy to talk about that. I think one of the things that I can speak to on that, Rasha, is the way we reorganized here recently, and we elevated Kim's role as Chief Clinical Officer, and she comes from the ranks. She knows the people. We flatten the organization so that people can get decisions made quicker. We expect our managers and directors to act independently, but with guidance, and empower their people to make decisions and feel comfortable bringing up questions and concerns. And we don't have, in my opinion, at all a fear-driven culture at Bartlett. We have monthly meetings with our directors. We speak openly directly to our employees once a month, and we take their questions seriously and we answer them. So we give every opportunity for people to have a voice in the ongoing operations of the hospital, and that's our approach, and that's the only way I know how to do it. And I wouldn't want it any other way. If I was an employee, I would want opportunities to speak up, raise questions, have my voice heard, and that's really important to us. Dallas can speak to that as well. He knows how important it is. We just handed out 1,000 burritos the other day, it seems like, to all the employees just to say thank you for doing a great job, and it was well received, and we actually needed more burritos, so we'll do it again. But it was a lot of fun, and as Dallas said, with the kind of ebbing of the pandemic a little bit, we can do more organizational things. We're going to have an employee recognition get together in April that we haven't had for 2 years, where we can honor people for their time here that they've been working at Bartlett. I'm looking really forward to that. I know the management group is as well, and hopefully we have a good turnout for that as well. We should. So I just speak to those things, and Kim can maybe embellish a little bit, but that's my take on it as well.
Dallas or Kim, either of you want to weigh in?
I'll just say, you know, as far as the, you know, are we a top down or a bottom up? You know, when I took the role as ED director, and in other roles I've had in other organizations as a leader, you know, really my philosophy is that my direct reports, I work for them. You know, they're my boss. And I make that very clear when I round to my teams and I say, you know, I'm not your boss, you're my boss, and you guys know how to do your jobs. And it's my role for you to come to me and say, hey, I've done everything I can do and now I need some support. And then it's my job to help find them that support and get their, you know, progress or their policies pushed through that they need. So I think, you know, I'm very transparent with my teams in that fact, and very open in conversation with people that, you know, I'm not, you know, I don't have this whole span of people beneath me. They are my boss, and I take direction from them when I need to.
Kim, thank you. I've got one more question and then we'll move on to another section of the program. But this one is also from a listener. And Kenny, I think this is a you question. This listener wants to know what active measures you're taking to ensure the board makes decisions for the hospital without bias. And they point to a couple of instances where there are board members who have contracted services with the facility. So they want to know how you make those decisions.
Thank you very interesting question. So if you go to any board meeting we have, or read any minutes or any recording, we have 9 very different individuals on our board that have very different opinions, and all of our board members are very strong opinion people that are extremely smart and intelligent, that are in our community, that love our community, that have been in our community for a long time. So I have not seen any board members per se make a decision based on something that's going to affect them financially. And I believe that's probably the question, that the bottom line is a board member making a decision that's going to affect them financially. And I have seen, you know, we have our board member that are physicians, you know, on the board that have eliminated themselves from a conversation because it could potentially be a conflict of interest. So I've actually seen them step out of a meeting and not take part in a particular situation like that. I also want to say something too, that you know, all like Michelle said, all of our board members put a lot of time and effort into really caring about our community and making sure that healthcare is going in the right direction for Juneau and taking care of our Juneau family. I mean, you know, anybody that comes to the hospital or anybody that works at the hospital, you know, are our neighbors that we go to the store with, our kids play baseball and soccer and football with, and grandkids do, and stuff like that. So if I flip this just a little bit, you know, the assembly takes a lot of effort into reading everybody's application, talking to applicants that apply to be on the board, and making sure that they really have a diverse feel of our board members. And I really feel that the assembly, and with Michelle Hale being our conduit between the assembly and the board, has really been able to get there with this particular makeup of our board. So I hope that answers your question.
It does. And Michelle, sorry, go right ahead.
Yeah, could I just add to what Kenny was saying about the conflict of interest declaration? As you'll see on the assembly, at a lot of assembly meetings, things will come up for which there might be a conflict of interest for an individual assembly member, or in the case of Bartlett, a Bartlett board member. And we have a direct pipeline to our attorneys, and we will separately, we'll ask that question: is this a conflict of interest? Do I need to recuse myself? Often people will recuse themselves. Sometimes on the advice of the attorney, we will just say, I have this interest and I'm letting the board know, but the attorney advises me that it's not a conflict of interest. So there is a really clear path for assembly members and board members to declare that conflict. And what I've seen is that people do take advantage of it and let the board know or recuse themselves.
Michelle, thank you. I think I've taken up enough time this morning. I'm going to go ahead and hand this over to my colleague, Claire Strimple.
Thanks, Rasha. If you're just joining us, you're listening to a special program from KTOO News on Bartlett Regional Hospital. I'm Claire Strimple with Rasha McChesney. And we're going to talk now a little more to Clinical Chief Officer Kim McDowell, Interim Behavioral Health Officer Karen Forrest, and Bartlett's Quality Director Gail Moorhead. And we're going to look at how the hospital has managed pandemic challenges over the past 2 years now. Kim, Karen, Gail, thanks for joining us. Kim, this first question's for you. Is Bartlett struggling with staff shortages similar to those we've heard about in other parts of the country?
Thank you for that. Yes, we are. Not as bad as other parts of the country, but what we did see with the pandemic that hit other parts of the country with staffing, Bartlett was not exempt to that. And part of, what we saw early on in the pandemic was nobody knew where this was heading. And so travel was restricted, trying to get tested in and out into different states. They wouldn't let you cross state lines in some instances. So we did see an outgoing of staff during that time that, had the flexibility to travel to see their family frequently. feeling like that was being threatened and not knowing what their future would hold. So we did have a number of employees decide to move closer to home because of that reason. You know, some decided, you know, like we saw across the country, that this was not, they didn't, you know, they were close to retirement. And this was a good opportunity to take early retirement and kind of get out of this pandemic that we weren't sure when it was going to end or how it was going to turn out. So we did see that effect, much like the rest of the country did.
And do you have a sense of how many open or unfilled nursing and medical support staff positions are at this time?
Kind of a generalization, but if you have a different number, Dallas, that'd be great.
I think that over recently, kind of in the last 6 months, we're regularly recruiting for 40 to 50, sometimes 55 positions, and that's our reality. With turnover, I report out, and it's in the board minutes every quarter on our turnover rates that anybody can kind of see. You know, one of the things I will comment on, Claire, that I think is important to realize is that we're trying to work on enhancing our recruitment and retention efforts, in both short-term and long-term strategies. And one of our long-term strategies, which gets to our nurse-driven leadership that question earlier, is really to grow our own and to provide career ladders within the hospital, to come on at certain levels of positions, and then support them in gaining the education and experience they need to move into other areas and move on with their career. And you can see examples of that that's happened in the past across the hospital, and then potentially into management. With starting in roles as lead workers and supervisors and into department directors. You can see across the board with many of our departments that we have a good mix of people that have come on board from outside and come on board and been promoted from within. And so I think that's another strategy that might help with keeping people on and also recruiting, and that people can see those opportunities and those examples within the hospital and want to come on board and work for us.
Thank you, Dallas. And we have a question from a listener. How is staff morale?
I can start with that, and then anybody else can jump in after. You know, I think in general, staff morale is better. It was pretty low during the pandemic. It was exhausting for teams, even though we did not get hit as hard as some of our colleagues did in Seattle and in Anchorage. It still took a toll. You know, it's all relative. And so it's hard for, you know, when there's visitor restrictions related to COVID patients, and, you know, the nurse has to be the nurse and then also be the family support for that person. So, you know, I think morale during that time was pretty low. We couldn't travel, we couldn't gather. You know, you've seen just as the community came together with the vaccine clinics and all of that stuff. You know, it's a close community, and they work well with Bartlett. And you know, we like to socialize, and so all of a sudden now one of our coping mechanisms were kind of taken away, which was to gather and support each other. I think now as the pandemic is lessening and we see less and less cases, and we're starting to find a new normal and things are relaxing, I think morale's better. People are able to gather and laugh together and share their lives with each other, and they haven't been able to do that in a very long time because of restrictions. So, you know, we have a ways to go with morale, but I think overall we're heading in an upward direction, and I think that's a testament to how strong our team is in our leadership.
Thank you. And another listener asks, with the inevitable increase of patients due to the upcoming tourist season, what is Bartlett doing to recruit and retain nurses?
Well, Dallas, I can start, and then you can jump in. Dallas spoke to that earlier. Some of the things that we are looking at, you know, we are getting some travel nurses in, which is good. That's something that we did not see through the pandemic either. So we're getting more travel nurses in, which is not unusual for us to bring travel nurses in through the summer to support cruise ship season. We just haven't had a full season in a couple of years, as you know. So some of the other things we're looking at, we have opened our emergency department up to hire paramedics, and so they're there to augment our staff, and that's been helpful. We have a really robust CNA program in conjunction with ASHNA that allows people to come in and start a CNA track, get certification and training, and that helps support our nursing teams. And then we also have relationships with UAA and Alaska Pacific University with their nursing programs to get nursing students in. And while we won't see, the fruits of that labor for a year, it does really open up possibility for nurses to come here and be able to stay in Juneau and at Bartlett, because COVID also hit the nursing programs, and so they saw a decrease in staffing and being able to get nursing instructors, which definitely affected nurses graduating and the amount of nurses that could graduate that really Bartlett depends on. And so circling back to Dallas, we really are looking at growing our own, and that kind of needs to be there to sustain us. So we have the CNA program, we have a surgical tech program that people can go into and train up to and have their own kind of non-licensed clinical ladder.
Thank you. And we have another listener question about the Omicron variant moving fast, and that's creating a high level of natural immunity. This listener wants to know, now that the landscape has so dramatically shifted, do you expect to drop any vaccine requirements for employees?
I guess I'll take that question initially, at least. We have federal laws that we have to follow that come from CMS. Right now, those laws don't allow us to change anything about how we approach vaccines in the hospital environment. And that's gone up to the Supreme Court and been upheld. And the board, if you follow the history of kind of how that developed over the last 8 months or so, kind of gave us some direction on what we needed to do before that requirement came and before the U.S. Supreme Court made that decision. And then since that happened, then we had that affirmation that federal law and those federal regulations we need to be in compliance with, we had already done through policy, and our policy aligned with what those requirements were. So unless that changes at the federal level, then we need to follow that regulatory requirement, and we can't make those changes. We have to follow them.
Thank you, Dallas. And that same listener would like to know if anyone was fired for not being vaccinated at Bartlett.
So with those federal regulations and with our policy, we have allowed people who have not been have chosen not to get the COVID vaccine to submit exemption requests in accordance with the law for religious or medical reasons. We've approved a number of those. I'm aware of one person that did not qualify for a medical or religious exemption, who was not able to keep their job and who did not want to get the COVID vaccine.
Thank you. Thanks, Dallas. Gail, you're on a team of people who are responsible for making sure the hospital is both safe for patients and a safe place to work. State and federal regulators found the hospital's COVID-19 safety lacking. What went wrong there, and how did you fix it?
Thank you for that. We actually had a OSHA investigation came down in December of 2020. And some of the things that they found that we could improve upon were some of our training was a little bit out of date. Of course, we were in the middle of a pandemic. So we have some requirements to provide ongoing training on things such as bloodborne pathogens, and also to do repeat fit testing. And a fit test is when a medical provider is wearing one of the N95 masks. It's a respirator mask, and it fits very tightly around your face. And each year you come in and we do a test to make sure you're still wearing the right size mask, because if it's not fit appropriately, then there could be some air leakage. So during that survey that came in, they found 26 of our employees were late for their additional fit testing. So to remedy that, we actually have trained other staff to be able to provide fit testing 24/7. Because as you know, our hospital, we staff every day, all day long. And to be able to come in on your off hours, if you're working nights or working weekends, a lot of times it didn't accommodate getting into the employee health office to get your fit testing done. So we actually trained up more staff that are available at different times of the day to keep people in compliance with that. Other things that we are continuing to work on are things like our employee safety programs. So after that survey, we took it very serious for our employee safety. And we actually created a new position and a new role at Bartlett. It's our environmental health and safety officer. So we have a dedicated person now to oversee all of our employee safety at Bartlett and looking to ensure that we are following all of the regulations and having our documentation in place. A lot of the things that they found during that survey were we were slow to keep our documentation up to speed. Of course, we were in the middle of a epidemic, and it was a little bit behind. Since that time, we actually have had a follow-up investigation by CMS. They came in a couple weeks later, did another survey for us, identified areas that we had already fixed and areas that we could improve. And we went through that process last spring, and they were they approved what our changes that we put in place. And we then in December of this year, we had our annual Joint Commission survey. Since we are get payments from the CMS, the Center for Medicare and Medicaid, we have to have surveys every 3 years. And our survey was delayed a little bit. It was supposed to be in May of this year. It came in December. And at that time with that survey, that they did not cite us for any infection control, which is that area, and the employee safety citations. So I feel that over the last year, we've put a lot of resources into keeping our employees safe and putting measures in place that we can sustain and make it through our COVID endemic rather than a pandemic. So I feel very confident in what we've been doing, that we have listened to what they told us and put strong measures in place to improve in the future.
Thank you, Gail. And so we're talking about the employee end. Now turning to the public, what are you doing to make sure the public feels safe coming to the hospital during the pandemic?
I'll start and then Kim can jump in on that. We did a lot of things through the pandemic. And as everyone knows, we were learning things daily, monthly, just like the public was. So some of the things that we did is we have screening at 2 points coming into our hospital. So we're asking people coming in, whether they're a patient or visitors, originally it was a lot about travel because we realized, Juneau, we are a little bubble and COVID was coming in from the outside. So we're focused on what, do you have any symptoms? How are you feeling today? Headache, all of the COVID-like symptoms that we all know. So we are screening people at the front door for that. And we are limiting how many people are walking through the hospital. We also set up a mask mandate very early in the pandemic to ensure that all of our staff, all of our visitors and patients walking through the hospital to their outpatient appointments were wearing a mask, because it is evidence-based that wearing a mask, if you're sneezing or coughing, it's going to help contain any pathogens from going to somewhere else. So those are some of the important things that we did for visitors coming into our hospital. In our patient care areas, our nurses are do an amazing job. I can't speak highly enough for our frontline nurses living through the pandemic and what they did to keep the areas safe. So a lot of what they did in the areas is ensuring that the patients are aware of, good hand hygiene, wearing masks, limiting your bubble. A lot of the education that the frontline staff were doing to help patients understand how they can reduce their risk or how they can keep themselves safe. And then, as you know, throughout different surges, when we were experiencing Delta, we actually had one wing of our hospital that we made the entire wing into a negative air pressure. So that way we could keep more patients in Bartlett and we didn't have to ship them to either Anchorage or Seattle. So it's been an evolving, challenging area, but I think we have some good established systems in place now that we can flex and move as we move forward. And Kim, if you have something to add, especially the ER entrance that we changed up.
Actually, really quickly, Gail, sorry, we're running short on time and we have a number of other questions to ask, so I think we're going to move on. Thank you.
Thanks, Gail. If you're just tuning in, you're listening to KTOO's special program with Bartlett Regional Hospital here in Juneau. I'm Claire Strempel with my colleague Rasha McChesney. We've got Karen Forrest, Interim Chief Behavioral Health Officer at Bartlett Regional Hospital. Hi, Karen.
Hi, Claire.
Hi. You took over leadership as the Behavioral Health Department saw a surge of mental health crises. Your predecessor said the department saw about 1,000 patients a month in 2020, and that the department was seeing an increase in youth cases. Has that continued in your tenure?
Yes, actually, it has continued. From spring of 2021 until now, December, we're over about 1,400 people, up from the 1,000 that was the previous data point. So we have seen that continue. And we have seen an increase in services provided across all age ranges in our Bartlett Outpatient Psychiatric Clinic. We've seen quite a large growth, particularly from 20 to 21. We've seen 33% more people served in our outpatient clinic, which is pretty significant growth.
And how is the department managing that?
Well, what's really exciting about what Bartlett's doing, and I was just so thrilled to come here and really kind of see the complete range of services, such a broad continuum of care that's been developed at Bartlett. I mean, I've been familiar with Bartlett, across my lifetime in other roles at the state government. And just the range of services that are now offered and particularly have been developed over the last couple of years are just tremendous. So just to talk a little bit about that, in late 2019, Bartlett added mental health clinicians to the emergency department service array so that anybody coming through the emergency department, we staff that 24/7 with a mental health clinician who can talk to people and find out, how acute their crisis is and determine whether or not they need, a greater level of care, maybe admission to our mental health unit, or, can we connect them with resources in the community? So that's been a tremendous service. And in 2021, we served over 500 people with that service. Also, Bartlett in early 2021 also developed crisis intervention services. And that's to complement the services that the clinicians are providing through the emergency department. So now, if you don't need to go to the mental health unit, but you do need some in-home services right away, and you don't have time to maybe get on a wait list and wait for some outpatient services, we do have the ability to see you in your home. So our crisis intervention team consists of 2 therapists and 4 community navigators, and they're able to meet with you where you are and work through and support you, whether that's for 1 visit, whether that's for 2 weeks, whether that's for a month. It's short-term service with the idea of helping you return to your level of functioning and also help you connect to other services. So that's pretty remarkable from what I've seen across the state in my role as deputy commissioner, for a hospital to be able to offer both the psych emergency services in the emergency department as well as the crisis intervention. Also, very exciting, the hospital opened up an applied behavior analysis clinic in summer of 2021. And that is for community members, children and young adults up to age 21 who are experiencing autism. And the state has provided a mechanism for reimbursement for autism services now. And so now we have this clinic and we're able to serve children in our community who are experiencing autism. And we have quite a wait list, and we're looking to see how we can expand that service because we know how important it is for our community. So in addition, what's really super exciting, I think, is that we're working with community partners to develop the Crisis Stabilization Center, which if anybody has looked as you're driving by Egan or up at the hospital, you can see that the steel is now being erected for this 3-story building, which will be a crisis center for the community. And we had a fantastic meeting yesterday with the chief of police and fire chief and the Alaska Mental Health Trust Authority to talk about, and Jamie Health and Wellness was there, just as we bring community members together to talk about what our crisis response will be for our community of Juneau. Every community is going to look a little bit different based on the resources that we have. So we have fantastic collaboration in our community, and we're working with our partners to really develop the best crisis response. The Alaska Mental Health Trust is working with other large communities to implement what's called a Crisis Now model, which we're looking to see how we can make that work for us and support the work that the crisis response team that we want to have here. So there's lots of really exciting things that are happening at Bartlett to address the behavioral health needs of our community. And it's wonderful to see this broad continuum of care. The Crisis Center is currently slated to open in the spring of 2023. And so, it's a construction project, so we'll see, if we're able to stick to that exact timeline, but it's been going really, really well. I want to give credit out to Dawson Construction and Northwind Architects and CBJ Engineering, who are just really working hard to make this go and be built into a really great resource for our community, and it's going really well.
Great. Thank you so much, Karen. And you anticipated a listener question with that information about the new behavioral health building. So thank you for that. We're getting close to time. Rasha, do you have time for one more question?
I do. Thank you. If you're just tuning in, you're listening to KTOO's special program on Bartlett Regional Hospital here in Juneau. I'm Rasha McChesney with Claire Strimple, and we've got Bob Teich here. He's the interim chief financial officer at Bartlett Regional Hospital on the line. Bob, you've been very patient, and we have about a minute left. You're just coming into this role, and we know that the hospital's auditor recently found deficiencies in Bartlett's internal financial controls before you arrived. Can you tell us a little bit about that quickly and what the office is actually doing well?
Sure, I'd be happy to do that. I've got 45 years experience in healthcare and 30 different facilities, so I have seen many different things. The issues that the auditors identified were some internal control issues, which are not unique to this hospital. We have, in the 3 weeks that I've been here, put in processes. We're looking at what we have been doing in the past. We've changed some of the ordering processes. We eliminated a number of credit cards which were in place when I got here, and better utilizing now the standard purchase order system, review by the directors, review by the senior leader, and I fortunately get to review and authorize all of them. So I get lots of requests to sign off on things, and it's just putting in better processes. And at times, in any organization, you do things a certain way for a long time and don't think about making improvements. And so that's part of what I do when I come into an organization is review the processes, look for a more streamlined way and better control.
Bob, thank you so much. We are just about out of time. I'd like to thank all of our guests. Thanks to those of you who submitted questions. Jennifer Pemberton, Miko Wilson, and Shelley Delaney helped produce the show. You can watch this program on our website at ktoo.org, and you'll find all of our Bartlett News coverage there as well. This is KTOO, Juneau 104.3. I'm Rasha McChesney. This is Claire Strimple. Thanks for listening.